Welcome, dear viewers, today on our health television. Today we have our expert Alexandra Kotthaus with us. She's a specialist in psychiatry and psychotherapy and general medicine. And what I really appreciate about her and what I'm really looking forward to is that we are going to talk today about cell communication, cell cooperation, and simply our body's intelligence. How we manage to bring patients into a holistic healing concept on the levels of body, mind, and soul. And that will be very exciting. See you soon. Hello, dear Alexandra.
Hello, Corinna.
It's nice that you're here. I already had the pleasure of doing interviews today with Thomas Rau and your colleague Jürgen Strein. And the colleagues have really demonstrated how biomedicine works holistically. And I always said I would like to have Alexandra here as well, because she really opens up the space for the whole thing. Because you have really specialized in this over the last few years for the patient in your center, in the Biomed Sonnenberg, really taking the patient on a whole new level. Maybe you can take us on the journey briefly. What has happened in the last months, years, where you say, hey, wow, now I'm slowly getting a key, another key to open the door?
Exactly. The journey keeps going. I started with the idea that everything is psychosomatic. I indeed had this idea in my head only to realize. So I had that, what I was after, this idea first there. Right after my studies, I was in internal medicine, then switched to psychiatry and basically found that wasn't really satisfying. The tools given to you, the classic psychotherapy, is relatively ineffective. And you didn't really achieve much. It was nice. The patients also felt good. Then I did a schema therapy training we once had as a whole team. And there was an exercise in it. Some may call it a fantasy journey. But that's also possible already. It's now depending on which one, whether you call it a guided meditation or directly a trance or hypnosis. That's when I realized, oh, if you include this element, a lot more can really happen. But this element also didn't work equally well for everyone, because now I would put it this way. If I do a hypnosis induction beforehand, then this journey works too. So that was the key I was missing to get people into the state of consciousness where I can deeply change things. The whole theory I already knew. And so then I actually, after the psychiatry time, which was not quite as satisfying as hoped, eventually came into biological medicine and realized, oh, I'm already much happier now than ever before as a doctor. And finally, you're doing something sensible. Finally, you're causing less harm. Finally, I am content myself. And the patients are much better off and healthier. And still, I am wired this way. You're not all set. So you have to continue on the journey. Yes.
Sorry for this very short commercial break, but please subscribe to our YouTube channel below. Not only does this help us spread this broadcast, but we can also reach much more people and give them hope. In that sense, thank you very much and continue to enjoy.
And then the last few years have turned out to be a very stressful time for many people for various reasons, social reasons, existential fears, whatever has crystallized. And I've realized I need to do more one way or another, whether I want to or not, on my already learned psychiatric psychotherapeutic skills, re-engage patients more intensively elsewhere. And then the whole thing evolved. And at some point it was like an avalanche. So from the first little dots, it eventually became a self-propeller. And then I did a training called brain spotting. Now, I'm not sure if I've mentioned this here before. It's kind of a further development of EMDR. Some call it the windshield wiper or wing wave method. But it's even simpler. I actually find it very easy, both as a therapist and more pleasant for the patient to carry out. And even with a higher effect size, en élégant méthode, simple méthode, effective méthode, but there might still be really deep, strange issues that might not be reachable. However, what is more superficial already there in terms of emotions, undigested emotions, can be addressed quite well. So you can already start with quite a few things. That is one of the methods that also have advantages. You don't have to talk if you don't want to. So that has been clear to me for a long time. Talking about a problem doesn't solve it. We women have a certain tendency, a bit like when we talk among friends, we generally feel better, even if the problem isn't gone. But generally speaking, even with bigger life events, neither the problem is gone, nor the feeling is gone, nor do I have a different behavior pattern after the conversation. Other tools are needed for that.
You notice, well, it also strikes me now that over the last few years, people were actively deprived of compensation possibilities. You could no longer escape into your job, to the bar, to the club, to a brothel, to whatever. So compensation was no longer possible and you had to face your issues. And either it was escape, addiction, depression, or burnout. So in this thing, we are moving a bit now, or illness. And when I often try to think of the origin or to talk with people, sometimes you really see pure fear when you try to address a topic. You surely know it, then you get a look like, don't almost open it, and then immediately comes, yes, that's why I stumbled, that's why I broke my arm. Or the strategy to evade. And I think it's nice when I hear you that there is apparently a method, as you just mentioned, that I can reach those who say, I'm not ready yet to completely, let's say, expose myself or to look at the topics.
There is currently such a topic area like shame and guilt that can fixate so unpleasantly on old things. By the fact that I now even have several tools, I also took a course in Chirotrance, where I have to say the description sounded pretty cool and nice before the course. And even I go there without very high expectations, because I've tried many things in the past that sounded great where I would say, well, that was nothing. That's why I'm a bit toned down in my expectations, but it wasn't a mismatch for me in terms of effort, cost, and what I can take away from it. So I think, okay, I'll do it. And then I was like, oh, wow, that was quite an experience. Yes, even for me, and it works. Chirotrance means I bring someone into a trance just with my hands, without words. And you think, yeah, right, it's probably due to the charisma of the hypnotist or something. Even I think that way. And then you actually get told the tricks, and then you know what physiology is behind it. And then it really works. And it has worked for everyone I've done it with so far. Everyone goes into a trance. And most of them then get up. I did it with our therapists because I think here the short version, the wellness version, you could learn that too, I think. I'll send you all to the course. And then they get up and say, wow, it worked for me too. Or wow, I feel better now than before. Or wow, I wasn't out of it at all. No, you weren't out of it. So because of this show hypnosis, there's such a false picture in many people's minds. and that you're then controlled and manipulable and so on. But that's not true. Of course, there are sometimes trances that go deep and then awak. Sorry, I shouldn't phrase it that way. You don't wake up, you come back. You don't wake up because you haven't been sleeping. Or, wow, what was that now? So I experience that quite often, and a deep touch.
Exactly, inner images, emotions. I think that's how you have a good access to this state.
Yes, but even that can be very protected in some people, depending on how big the wall around it is, how thick the protective shell. And then I don't try to break it with force the first time. Instead, these methods like brain spotting, neurotrans are actually quite suitable, where you can work without language.
I find it natural when I listen to a wonderful instrument to engage in cell communication. Because if I assume that every illness might be a little tap indicating that something in life isn't going optimally, but how it's not again.
I'm not saying it's not the case, but I also quite enjoy playing the devil's advocate. Just to shake things up and break down mental barriers. Yes, and then of course I also practice classical hypnosis. And then I attended an additional module called Hypnosel. And that is something incredible. And with Hypnosel, but I must say I have a slightly different setting than most hypnotists because I usually know my patients beforehand. And they don't come to me not knowing me, and then I conduct hypnosis. Instead, there are, of course, already feelings of illness, perhaps also family issues, which is something a bit different. That means I can sometimes approach things a bit more aggressively. But my experience is when I say, hey, we go into their cells and we talk to their cells, and sometimes even cancer cells. It works like a charm. It happens effortlessly. I don't have to dig deep into the bag of tricks to bring someone into hypnosis. But it's really like the cells and their owners are just waiting to finally come together and communicate with each other. And honestly, I am sometimes quite touched and amazed by what happens, what the cells also say. And that makes me rethink some things completely. Also approaches in biological medicine, but the answers of the cells can be so colorful and diverse, even when I ask them what they would like to eat. So I also ask ill people, the cells, what would you like if we have, so to speak, made the cell healthy again in hypnosis until it really is the case. But you can also inquire about that. That takes time. And I also don't say that in hypnosis you treat the whole illness. It is usually more complex. But I can then ask the cells, what do you need? What do you want? Do you want something specific to eat? And then ginger lemon tea might come up. Then there are mitochondria that say honey. Then there is bone marrow that said avocado. And I ask, do I need a specific vitamin, mineral, infusion, other therapies? I now also inquire about that. But do you know what the cells need? What the most common answer is? Love and attention. And that's why cell cooperation. And afterwards, people have a different relationship with their cells and their body. They are much more forgiving when the body aches and pinches, because they know the body wants to tell me something. Maybe I haven't treated it well recently. When we look in the mirror in the bathroom in the morning and think, oh shit, what's that there? Spots, dark circles, or cellulite, or whatever. Our cells are not happy about that. There are also sometimes cells that are already programmed in such a way that they work for us, come what may, no matter how stupid we behave towards them. But if you make it up to them again, if you tell the cells, I'm sorry, I really wasn't aware of it, I also don't make false promises. I also don't give weird suggestions in hypnosis. But the willingness, do you really want to cooperate with your cells and be good? And I tell the cells, oh, hang on, your owner needs to practice a bit more. Be lenient. Just show them that was good, not good. And then they go along with it, and the cells go along when you keep your word, and then they're not just with you again. Yes, we function somehow because we mix, and they work with us again. And that is delightful. It is wonderful. So what I receive as feedback, I say, write me an email in 1 or 2 weeks, and that is really nice. And you gain a completely different awareness of how intelligent our body is, even when it sends us a symptom. It sends a symptom because we haven't resolved something somewhere or something is wrong, but it never sends it actively to deliberately annoy us.
What I also find very exciting, maybe you feel the same way, is that after years, somehow it goes faster, easier. I was at such a clairvoyance seminar over the weekend, done it many times, and now I was really with such an older, pragmatic 70-year-old Swabian, sit close, say what comes, it comes. And I thought, a few years ago, when we even started at all, I think, hey, it's so brilliant how easily and quickly we get the answers. And I also find it beautiful, of course, when therapists and doctors, like you say, at first it works. That's naturally a huge door opener, both for the patient and for many colleagues who say there must be something more to support my patients. Because we had massive propaganda against this way of dealing with people saying, hey, your body is communicating with you. It was always dismissed as nonsense, esotericism. Every cover was laid over it to make everyone afraid to engage with it. That's like warfare, which we now have in our society as well. So really, from your perspective, I would be interested in what has changed in the past years and how you perceive colleagues and patients where you might think 5 years ago I would have with the topic still not able to come. There would probably be something happening somewhere.
Yes. So I've also tried various things for 20 years, pushed them in. And I thought to myself, nope, doesn't fit, doesn't work. Sometimes it just complicates it that way. Yes, well, if it works for half of it, it's not yet, so that I can apply it well to myself. There, I would like to have like 80% is a magical number in medicine. It is insanely difficult to get higher. And also the conventional medical means, medications, almost nothing has 80%, but instead it's statistically significant higher than a placebo effect. And sometimes it works in 50%. No, I actively looked up yesterday the number needed to treat for very specific, I think it was telmisartan or something, blood pressure medication, and was a bit astonished. I had like 90 in mind, and the number was, I believe, 160.
What is the name of the medication?
It was a blood pressure drug. And I thought it was indeed 90 for the blood pressure drugs. Number needed to treat, that is, how many patients do I have to treat? And there was the defined starting point to prevent a death, that is, a premature death. And so you have to treat 160 people with this medication to prevent one death. So efficient, these are official numbers. You can just look them up simply. These are the studies. And sometimes, I don't know, if I'll express myself cautiously, not everyone deals with the efficiency of certain measures. Our scene is gladly put in a bad light, ridiculed, although we can often keep up quite well. Yes, we also have quite a lot of blood pressure patients, and it works pretty well. And it is also very exciting with the blood pressure patients. Most improve in the first 3 months. can taper off medication. And then I've also recognized a pattern, who gets worse afterwards. What can I say? I then offer them the hypnosis.
It's also about where do I put more pressure in life? Maybe you can still briefly take us through a few classic things at the end. I know you're not a fan of generalizations, like if you have this, you have that. I totally understand that. But at least if someone is watching and says, I have blood pressure, just like that, give us a few cell responses where the cell seemingly does have a topic. Maybe one or the other will find themselves again to get a feeling for it. You can also take another example. But what does a cell typically respond with?
The answers are extremely diverse and extremely individual. I have patients with life stories where there is potential for a real, even psychiatrically defined trauma. And then something else comes out. And sometimes it's the trauma where someone says, yes, I thought I had already worked through it. The cell's responses, what's fundamentally behind it, are extremely individual. But when I lead someone into a cell and we start with a few good cells, they are described very similarly, although they have an extremely individual touch. I can look at and influence the mitochondria, and it will be described similarly. The cell membrane describes a healthy cell membrane is actually described the same by all people when I ask how it feels. And the sick cells, they also have, even if it's individual, there are very large commonalities in how the disturbance manifests in this soul language, what they first perceive within the sick cell. But what lies behind it can be incredibly individual. Sometimes it's pressure. We were also on a DNA island where there was once a volcanic eruption. Energy really built up there over time. And since you learn sooner or later as a child or young person that it's not appropriate to explode, it then basically imploded and presented a clinical picture that fits. But it can also be with a patient, I thought, even though I'm open during hypnosis, but it was somehow a disease where death would play a role historically. And then it was actually birth, where the mother received anesthesia. But also sometimes undersupply in the womb. The mother is startled, the vessels contract, the umbilical cord receives less blood flow. I wasn't quite aware of that before, what all this can trigger. Then the blood flow returns to the umbilical cord. The child breathes, which can lead to, in later life, when there's food I have to eat. Such a scare can happen. A circulatory disorder during pregnancy can leave a deep-seated shock. There are also people who have a life-threatening illness, but where no trauma can be found. They were nonetheless in a tense situation for years as a child. There are cancer cells that say, you go into your cancer cell, and the owner says, doesn't work. Try again. Tricks were done. I'm in with my head now, but I can't get in. She won't let me in. She's so closed up and has shut down completely. There are no pores to slip in. I'm saying, pull your head back out, put the cancer cell in front of you. We're talking to the cell. The cell asks, what's going on? I say, let the cell let you in. You want to kill me. The cell says, okay. Then I wanted to mediate with the owner, open your heart to the cell. The cell says, for me, it's still okay. I say, don't open my heart to the cell, it wants to kill me. The cell says, okay. Then I also have to resort to tricks. Then we negotiated a truce between the cell and the owner. That, of course, went pling. You want to kill me, says the cell. Then I say, you cell, do you even know that you'll kill both of you if you go on like this? Then the cell says no. the symptoms subsided in the patient. He had an active bleeding from the tumor. The blood values improved. The process is not quite over yet, but it was wow. But I also had cancer cells that said, yes, I know that we're dying. That's the plan. The suffering in this life was simply too great. And that's why you have to just stay open-minded. Never assume when approaching this matter. Or, as it was said in brain spotting training, always stay in the shit of the comet.
And of course, when I listen to you, it certainly is an experience one must have themselves. Because when you listen and have never had the experience of communicating with your own cell, I think now of the viewer who has so far said, okay, I'm looking for alternatives, medical methods, HRV measurement, and microbiological analyses. And now suddenly he hears something about the cell responding and saying, here, this is our plan. And the beautiful thing is really when you open yourself to it, why not? So why not have the courage to engage in this self-experiment and say, I'll see if anyone talks to me. And the beautiful thing is it does something with the patient. You see it when the cell responds. It's like a light turns on in the patient and you think, wow.
So it's also fascinating, touching, and incredibly satisfying. Yes, for me, of course. And it took a long time. And because I had done all the other training before, I naturally now have a lot of detailed knowledge. Yes, once I had a hypnosis session and there in the body. But then I knew, oh, that's the same meridian. Then I can also take the detour there. Then I can also check the organ again. Then I can also check the lymphocytes.
Or the tooth with the organ.
I had to talk to the half-dead tooth just before an intervention, before an operation. So you tell the cells, watch, listen, something's coming, foreign bodies are coming. Telling the body after the surgery, you can keep your blood for yourself. So you can significantly improve an operation's outcome with this, accelerate the healing process. And then we talked to the tooth, which was hanging by a thread, so to speak. Well, sorry, but the plan is you're supposed to come out. And then it says, thank God I can't hold the position anymore. Yes. And talk to the jaw. It also said, actually, it would be a relief if it came out. Yeah.
Nice.
Yes.
Thank you very much. I'm looking forward to another interview with you, and I find it so brave also from you, I must really say, even as a doctor, because I always see this. Of course, I have doctors we do interviews with, and when the camera is off, we talk about these things exactly. And often it also comes up, I can't really say that on television because not everyone is ready for this information yet, and I also don't want to be pushed into such a corner. And that's what I find beautiful about you.
But it's not, I don't see it that way at all. Look, brain spotting is a training that's really only for licensed psychotherapists. Hypnosis is also not unknown in school psychology they're actually not weird, far-fetched, fantastic methods, but also methods that have their proof even in research. And I would like to say, even with this cell cooperation, it doesn't mean to me that I only find the underlying, perhaps emotional reason or so, but for me, the body is part of it. It's not an either or. Our bodies are part of it, and treated well, we can achieve really great things.
Super. Thank you very much, Alexandra. Nice that you were here, and I'm looking forward to our next interview.
Thanks.
Thanks. Dear viewers, wonderful. So nice to include body, mind, soul, and even ourselves in communication, and to feel and perceive how easily and quickly something like this can happen, and also the insight that perhaps paves the way for one's own healing. And of course, we thank you very much for watching. See you soon. Goodbye.
Thank you for watching Swiss Health Television QS24. Please don't forget to subscribe to the channel down here, or watch all of our programs ad-free via Wikisane, or consume this selection of programs. I wish you all the best. Until another time, and goodbye.